Yeah, one more important question we see in this the flight while going, where in the air somebody got suddenly collapsed, could be heart attack, something else, and we have many stories also. Somebody did a CPR, sometimes successful, sometimes not successful. So how practically should assess it? Suppose I am going in a flight, I am a layman, I am not a doctor. Someone suddenly collapses next to me. So what I am supposed to do as a common person?
So the question arises when a person suddenly collapses whether the person has a cardiac arrest or not. Cardiac arrest basically means heart has stopped pumping, and that's why the patient has collapsed. What you need to do first is call out the person's name or say sir or madam if you don't know the name, and see if the person wakes up or shows some response. This should happen in 2-3 seconds. Next, pat the person and see if any response. Again 2-3 seconds. Third, go for the carotid pulse. If the person is still not showing a response, keep your thumb beside the airway here in the neck and see if there is any bounding pulse. It's still not there. This again, all these three things: calling name, patting, checking the pulse within 5 to 6 seconds. Then you need to start the CPR, which is going to be the life-saving measure for the person who has collapsed beside you. And how CPR has to be done, what are the techniques, the guidelines, we will deal in detail in the next video.
Do you think common man can do CPR?
Yes, absolutely. I think everyone should be knowing to do the bystander CPR. It is a life-saving skill.
So CPR must be known to everyone, so that you don't know what happens what time. You're going in a metro, you're train, you're traveling some destination, somebody collapses you, and this CPR. And what is the people common? We know we do the demonstrated next session. What are the common mistakes people do when doing CPR? I heard some people do the chest grips while doing exercise.
The most important mistake that people do is not initiating CPR. That is what I feel.
This is very essential. Whether good or bad, start
the CPR. Don't worry about breaking the ribs and all. If you are breaking the rib, you are doing a good CPR. And the rib fractures do not require any surgery. They auto heal in 2 to 4 weeks. So don't worry about breaking bones. If you are breaking bone, you are doing a good quality CPR. We will deal with this, all the points, myths, facts about CPR in our next video at length.
And in a normal, theoretically, and in your practical experience, clinical experience, what is the success rate of CPRs?
See, success rate is somewhere around 25%. That is far more than 0%, right? So you should be doing this.
This is very important. You may not save 100% people. I think there is a high chance of saving 20 to 25% people. So CPR is essential. So next session, next vlog, we come up with the detail how to do CPR practically.
Very essential. So, some European countries, they give driving license only after they know the person knows CPR. That's mandatory.
So especially in India also, all the Ola, Uber drivers, and even the pilots, aircrafts, people, everyone should know aware of the CPR. Better they have certified CPR.
Yes.
If they are certified from a good institution or good things, at least they boost their confidence, and even the attendant who are having CPR with them also, they have more confidence with them.